welcome to the Wellness Bridge. I'm Gary Chen, physiotherapist and founder of GC Integrative Physiotherapy and Wellness on the Gold Coast. This is where Western science meets Eastern wisdom for whole person healing. Today is about the invisible work that happens after an older person comes home. The discharge papers arrive. The walker sits near the lounge, and suddenly the daughter becomes the system. She checks tablets, watches every step, answers every frightened question, and sleeps with one ear open. This episode is not about blaming one hospital, one doctor, or one family. It is about what happens when home care lacks continuous interdisciplinary follow-up. The research points toward reablement, where aging at home becomes an active project, not passive decline. That means physio-led care, medical coordination, nursing support, strength work, and caregiver support working together. Because sometimes mom is not the only person losing confidence in that house. Our guest today is Jenny, a Gold Coast-based 56-year-old composite family caregiver. Jenny, when your family member came home, what did daily caring actually look like?
It looked like being alert from the second I woke up until I finally fell asleep. I was checking whether Mum had eaten, whether she had taken tablets, and whether she looked unsteady. The hardest part was the constant calculation before every simple thing. Could she get to the bathroom safely? Could she stand long enough? Could I leave the room? I remember watching her shuffle from the chair and feeling my whole body tense. My shoulders were always up near my ears, and my back started aching from helping her move. I was not doing heavy lifting all day, but I was bracing all day. It was the mental load that surprised me most. People would ask how Mum was, and I would answer, then realize nobody asked how I was. I felt guilty for feeling exhausted, because she was the one who had lost independence. But I was losing parts of my own life too. Quietly and slowly. I stopped walking in the morning because I was scared she might need me. I stopped seeing friends because explaining everything felt like another job. Some days I felt proud, and some days I felt trapped. I loved her, and I also needed help, which was hard to admit.
That honesty matters because caregiver strain is not weakness. It is a predictable human response to responsibility, vigilance, interrupted rest, and emotional uncertainty. Evidence shows caregiver interventions can reduce depression, especially when support includes CBT or mindfulness. When carers get structured emotional support, many find their own mood and resilience improve too. That does not mean a caregiver should self-diagnose or manage burnout alone. It means support for the caregiver is part of making home care sustainable. The physical side matters too because older adults often need reablement, not just assistance. Reablement means retraining daily skills like dressing, cooking, standing, walking, and moving with confidence. Reablement, short-term coaching toward doing daily tasks again, can help people rebuild independence at home. Interdisciplinary home care was also linked with fewer hospital admissions in the months that followed. That usually means more than one professional is involved, such as a physio and nurse. The goal is early detection, tailored planning, and fewer crises that send people back through hospital doors. Jenny, what changed when support became more structured at home?
The biggest shift was that someone finally looked at the whole situation. It was not just Mum's pain, or Mum's walker, or whether the house had grab rails. It was Mum's confidence, my stress, and what we could realistically practice each week. We started with small movements that connected to real life. Standing from the chair became training for getting to the toilet safely. Pulling a band toward her body became practice for grip, posture, and getting herself steady. I remember her opening a jar one afternoon and looking genuinely surprised. It was not dramatic, but it felt like a piece of her came back. For me, the change was having a plan, instead of just reacting. I knew which exercises were for strength, which were for balance, and when to stop. I also had permission to say I was tired without feeling like a bad daughter. That changed the atmosphere in the house. Mom stopped feeling like a burden, and I stopped feeling like the only safety net.
That is the bridge we talk about on this show. Western science tells us structured resistance training can support grip strength and physical performance. Gentle strength training, a couple of times a week, is widely recommended to help rebuild strength and confidence. Pulling movements are especially important because grip is built through sustained hand and forearm tension. Adding pulling movements like seated rows can help support grip in everyday carrying strength. For your family, that can mean jars, doors, rails, walkers, and safer transfers. Eastern movement traditions remind us to notice breath, attention, posture, and the felt sense of movement. In our clinic language, Physio-Q means physiotherapists design Qigong-informed therapeutic movement for balance, breath, body awareness, and movement confidence. It is not energy healing, and it is not a replacement for medical care. When someone says Qi, I translate that clinically as autonomic interoceptive awareness. When someone says meridian, I think carefully about neurofascial lines of movement and sensation. When someone feels the key, I frame it as a patient-perceived sensory marker, not a mystical guarantee. For caregivers, this matters because your nervous system is in the room too. If your breathing is shallow and your body is braced, the home can feel like a ward. With the right support, it can gradually become a training environment for independence again. Jenny, what would you say to another daughter or family caregiver listening tonight?
I would say, do not wait until you are completely empty. Ask for a proper care plan, and ask who is coordinating it. I would also say your body is giving you information. If your back hurts, your sleep is broken, and you feel constantly on edge, that matters. I am not giving advice as a clinician, because I am not one. I am only saying that asking for help earlier would have saved me a lot of shame. Caring became more possible when I stopped pretending I could hold everything alone.
That is a powerful place to finish. If you are caring for someone at home, please do not ignore burnout signs. Persistent low mood, panic, anger, sleep disruption, or hopelessness deserve professional support. Speak with your GP and consider a psychologist or qualified mental health professional when needed. From the physical side, ask your provider about an interdisciplinary care plan. Ask whether reablement, supervised exercise, strength work, balance practice, and home safety are being coordinated. If there has been surgery or fracture, early rehabilitation within the first 90 days can be important. The evidence links earlier home-based exercise with better balance outcomes and reduced readmission risk. But every person needs assessment, medical clearance where appropriate, and care matched to their condition. Exercise is a first-line non-pharmacological strategy for many aging-related functional issues. It works best when coordinated with the medical team's overall management plan. Bringing mom home should not mean one family member silently becomes the whole care system. It should mean building a bridge between evidence, movement, medicine, family, and sustainable support. Jenny, thank you for lending your voice to so many caregivers who feel unseen.
Thank you, Gary, because being seen is sometimes the first step back to breathing.
This has been the Wellness Bridge with Gary Chen. Until next time, care for the person you love and remember that you are part of the care plan too.